Hi, I'm Dr. Jamie Moenster, board-certified plastic and reconstructive surgeon at Dermatology and Plastic Surgery of Arizona. Today I'm going to discuss the three different types of breast implants, talk about some of the pluses and minuses for each. The original type of breast implant is our saline implant. The saline implant has a little fill valve. This fill valve allows for the surgeon to fill the implant during the time of surgery. The outer shell of the implant is a silicone shell, which is similar to the other implants. During the implantation of surgery, the implant itself can be rolled to a very small size and inserted through the nipple, under the inframammary fold where the underwire of a bra goes, or through the underarm. Some of the pluses about saline is that you can get a very small incision. It's very, very safe if the implant were to rupture as IV saline is placed in the implant. Some of the negatives about saline is that they can tend to ripple. They can sometimes have a sloshing effect, and because of this valve, they can have a tendency to leak. The second type of implant is the cohesive silicone gel implant. Again, the same shell as the saline implant, except for inside is a pre-filled, very soft silicone gel. This requires a little bit larger incision, an incision of about 4 to 5 centimeters, which is just under an inch, an inch to 2 inches. The silicone gel implants have a very natural feel. They're softer than a real breast. If this were to be poked with a pen or cut, it would stay together, much like a Jell-O mold. These are one of my favorite implants for the way that they feel. The negatives of these implants is that they do become pre-filled, so you can't customize the size, but they come in about every 25 cc's. There is also an 800 cc limit to the max size of these implants, but they're a very great option. They are typically round in shape, so the implant can spin. There can be some rippling in this implant as well, especially if somebody is really thin or if somebody is a breast cancer survivor. The most recent type of implant to be released is the third generation highly cohesive or form-stable silicone implant. This implant has a textured shell. It is shaped much like a natural breast from the side, and also with it being wider in the middle portion and the bottom portion than the top portion, again like a natural breast. One of my favorite things about this implant is that form-stable doesn't allow for any rippling or wrinkling of the implant, and that it does give a little bit more of a natural look if that's what you're going for. Again, the negatives of this implant is because it's so much firmer than the other implants, some people don't like that firmness. It's more of a youthful breast feel. The other thing is that this requires a minimum of a 2-inch incision, 5 to 6 centimeters depending on the size of the implant. This implant, because it is shaped, also has about a 1% chance of turning. If the implant turns, it has to be replaced. So there's a quick review on the three types of implants that are available for patients.